I'm here to talk to you guys about the Zika virus. So just to give you guys a bit of background information on the epidemiology of the Zika virus, it was first discovered in 1947 when scientists were doing a routine surveillance for yellow fever in the Zika forest of Uganda. They actually found isolated cases of Zika virus in the rhesus monkeys in that forest. And by 1942 or 1952, the first human cases were detected in Uganda and Tanzania. So in 2018, there really have been not a significant amount of cases in the United States, but the areas most at risk for Zika virus are Africa, Asia, the Caribbean, Central America, Mexico, Pacific Islands, and South America. So it's important if you're traveling to these areas or live in these areas that you're practicing safe habits in these areas just to avoid getting infected. Typical signs and symptoms of the Zika virus are fever, rash, headache, joint and muscle pain, and conjunctivitis, which we know as pink eye. Only 1 in 5 people will experience symptoms for the Zika virus. So a lot of people who are infected don't even know that they have been infected. So they don't realize that they're transmitting it to more humans. But the symptoms typically resolve within 2 to 7 days. So you're really only experiencing symptoms for about a week if you are experiencing any symptoms at all. And death is extremely rare with the Zika virus. So you don't have to worry about anything too serious with the Zika virus. However, there are some abnormalities that it causes, so it can be dangerous, especially for anyone who is pregnant. You can get the Zika virus, again, it's mosquito-borne. So mosquitoes become infected when they feed on infected humans, and then they will transmit that disease to other humans through mosquito bites. Humans can also transmit it to other humans through unprotected sex and blood. There have been some cases reported of Zika virus being transmitted through blood diffusions as well. So the most serious, like I said, if you are a pregnant woman, you can transmit it to your baby, and that is actually very dangerous because it can cause something we call microcephaly, which is a very serious birth defect. It's a condition in which a baby's head is significantly smaller than expected, and it's often due to abnormal brain development, so it can cause some brain defects as well. If you do have Zika virus and your baby ends up having been born with microcephaly, people call it congenital Zika syndrome. So the pathogenesis of Zika virus, when a mosquito bites you, the virus will inject a single-stranded positive RNA into the cell, and that RNA is then translated into proteins by our own cellular machinery into more viruses. So eventually the cell will die and the virus will exit the cell and infect more cells. The way that you can detect Zika virus is through blood samples and urine samples. There are some other ways to detect it, but these are the 2 main ways to detect Zika virus. Again, you don't experience a lot of symptoms, so the only way you can really tell if you do have Zika virus is through paired serum and urine diagnostic specimens. So, if you do find yourself in areas that are higher risk for Zika virus, there are 3 ways that I would say are the best ways to prevent getting infected. The first is to protect against mosquito bites, so use mosquito repellent. The Zika Foundation has a list of approved mosquito repellents. The top on their list is Sawyer Picaridin and Natrapel 8, followed by Deep Woods Off. So those 3 will provide the longest amount of coverage and the strongest amount of coverage. Also, invest in mosquito nets and destroy mosquito breeding sites, so anywhere that there is still water, gutters, trash, spray insecticide and make sure that there's no still water because that's perfect grounds for mosquito breeding sites. Also cover up, wear the right clothing just to avoid that mosquito bites, and also keep windows closed. So It is also important to take preventative measures while traveling. So the CDC recommends taking anti-malarial pills because it is co-endemic with malaria in 30 to 40% of the Zika range. It's also important to obviously avoid areas like standing in water and trash. They also recommend to select hotels with screened windows and doors and utilize fans and AC just to avoid mosquitoes being able to enter. Also, it's important to avoid unprotected sex, especially in these areas with higher risk of Zika virus. So if you do find yourself infected with Zika virus, you can take medicine for the pain and fever, get plenty of sleep, plenty of rest, and drink a lot of water, and call a doctor if you have any other concerns. However, there is no specific vaccine and there's no specific treatment for Zika virus, so you kind of just have to let it run its course. So that is all I have on the Zika virus. If you guys have any other questions, you can ask me or comment below.